I would like now to give the floor to a colleague and friend with great contributions to the clinical engineering field, Rossana Rivas. Rossana is an active CED collaborator and senior advisor in WHO Collaborating Center for Health Technology Management, and she will present to us America's health technology policy.
Thank you, Kali. First of all, very nice and honored to share this amazing session with my colleagues and partners. Let me take just 1 minute to my dearest leaders and inspiration in the development of the profession. Adriana Velázquez from Mexico, Laura San Pietro Colon from Spain, Kathy Leblanc from France, Carol David Smith from US, Rossana Tarricone from Italy, and Amelia Villar and Patricia Caballero, both from Peru, who are fighting, working, one of them at the end of her life, even with amazing challenges in health. Okay, so we can now start by saying, yes, I am a member of Clinical Engineering Division of IFME and also head in the Clinical Engineering specialty at the Biomedical Engineering undergraduate program in the University Cayetano Heredia of Peru. Let us start, Kali, please. Okay, just to give a shot about what is going on, in the numbers in the right, you can see what is the picture, the scenario we are dealing with, women and men, of course. This scenario set a lot of challenges, and challenge is a very kind and formal way to describe the desperation, crisis, and absolutely sustained disappointment we all are dealing with among the weeks, months, and now years. But I would like to share with all of you that health is part of the right, of human right. This is something key and essential as medical devices are, as vaccination are, but this essential component should be on our minds to guide and to support what the efforts are demanded and much more from that. The other highlight is that certainly the Americas have been developed a lot of improvements regarding health technology, but this is what not enough before the pandemic, and this is not enough more in the middle of the crisis. Budgeting, lack of information, few number of trained healthcare professionals, lack in some countries of number of clinical engineers or biomedical engineers. This is changing, but if you think about other brothers in the world, this is changing slowly. Next, please, Kali. So, just to set some points about health technology relevance for these challenges and expected results we have. We need health technology to improve diagnostic, healthcare services, prevention, development of solutions, manage the disasters and the emergency. So if we are not able to realize that there must not be no who excluded, no what excluded in the list, there is going to be really a tragedy in the Americas. We are doing our best. We are not just asking for donations. We are needing guidance, yes, also this type of exchanges and discussions. But most of all, we need everybody understands we are in the same world, but in different part of the world. Some of you, and God bless you, are in the, not, I won't say bright side, but you are in a boat. You have some kind of saviors to survive, some kind of glasses to use. Some other countries, like the Americas, are downstairs with the water going out inside of the boat, with some of us with diseases and many of us dying in the process. Yes, we are living the same pandemic, but in certainly different ways. Thank you. Next, please. What then is health technology policy pertinent? Why is so important in addition to deal with other aspects, topics well presented by my colleagues today? Because these policies sustain the continuation, but also the adequate state of what is the framework to work, what is the framework to achieve the objectives, not just operational, but strategic. And most of all, through health technology policy, we are going to be able to assess, control, make the guidance on time, and avoid the population, vulnerable, old, young, etc., be damaged by the lack of a good framework, as by opposite as our lovely other brothers among the world. Next, please. What then are the challenges? I just want to, again, set the point that despite the efforts and progress we are doing through networking with the enterprises and the armies and the church and the government and other non-profits from international scenario, we still have marginalized, underserved communities, totally forgotten before the pandemic, but now with the pandemic, we keep being forgotten. They keep being forgotten. How to be able to achieve this challenge, how to be able to change it, and at the same time, how to be able to improve our efforts, knowledge, awareness, and skills on time. How to be able to don't desperate because our people is dying or for sure will die. On the meantime, we are talking in this valuable and very nice session. Next, please. I would like just to point some three aspects. You can read the slide, but I would like that in the context of COVID, in the case of the Americas, to stop the sustained increasing of number of infected people, we need to improve right now the COVID-19 diagnostic. For that to happen, we don't just need medical devices. Of course we need it. We need knowledge, we need training, we need policies, and most of all, health technology management and planning. And this is all involving clinical engineers in the field. This is the best moment of my life, as much also one of the most challenges. Adriana talked about not going be emotional. I believe that we cannot avoid to be emotional. Before the pandemic, as we shared before, biomedical engineering undergraduate program in Peru is increasing since 2017 in a very much positive way. And it happened to be that in the day of my conference to the new students, my father died. I asked myself what could be the best way to give honor to him. He knew each day of his life how much committed I am with the objectives of this profession, not just for Peru, but in a global perspective. And I did it. But I requested my partner from US, Venezuela. In that moment, my partner was Ricardo, excuse me, Ricardo, I forgot your last name now. If I have some emotional problem in the middle of my conference, please support me. He didn't know that before. And I did it. And then I rushed to attend a family problem. Another emotional thing that we are dealing with, yes, women are dealing with the home and with the family issues. We are sort of balanced to keep everything in shape, right? Okay, think about having a family with muscular dystrophy in the middle of a pandemic, or think about the ones who have to take care of all people close to your family closest, all at the same time, with the certitude that your death is possible at the second you get infected. Because in countries of the Americas like Peru, as I said in the amazing meeting of clinical engineering division before, the lack is not just oxygen. The lack is hospitals, medicines, physicians, nurses, technicians. You have the certitude that if you have infected, you probably have a high percentage to die. So the positive side of this fact is you should be able to do the best in the time available. And clinical engineering brings a lot to make this happen. These networkings, this amazing network with clinical engineering division, the support absolutely awesome from WHO, from PAHO. This is what will make a difference on the meantime. Next, please. Thank you very much for this important session. I am very glad to have this opportunity and looking forward for the discussions or potential questions. Thank you.
Thank you, Rossana, for your touching presentation. Thank you very much.